It's time to take a new approach to finding true fulfillment in your career, health, and state of mind through insightful conversations with those who have found their professional and personal passions while achieving balance. Whether it's entrepreneurs, athletes, or healthcare professionals, we bring you real people, real growth right here on the Boost Podcast. Now, here's your host, Elena Lipson.
Hey Boost Squad, and welcome to episode 38. Elena Lipson here, and we are in for a treat with today's featured guest, Alex Go. Alex, are you ready to join the Boost Squad?
Hi, Elena. Yes, I am. Thank you very much for having us.
So before we dive into today's episode, I want to give a shout out to our sponsor, Mosaic Growth Partners. Mosaic Growth Partners provides growth strategy consulting to entrepreneurs and organizations in the healthcare and older adult baby boomer market. They can help you bring a new product or service to market, identify and engage new customers and partners, or grow your market share. They also provide coaching and training. For more information, go to mosaicgrowth.com. That's mosaicgrowth.com. Now back to today's featured guest.
So Alex is the CEO and co-founder of LivWell Health, which is a technology-enabled services provider that assists seniors to live independently at home and also for families seeking assistance in their care. Their goal is to make caregiving easier for the 44 million Americans that are caring for older adults and special needs children. LivWell Health partners with senior service providers to expand the markets they serve, with the goals of enhancing revenue and improving staff productivity. Prior to starting LivWell Health, Alex had more than 20 years of experience in strategic planning, sales and management consulting in healthcare and IT. He previously led Intel Health's market development team in the US and Asia. But despite spending 2 decades in healthcare, it was actually Alex's personal experience that led him to start LivWell Health. And we're going to hear more about that on today's episode. So Alex, let's just dive right on in. I want to know more. What are the 3 things that we should know about LivWell Health?
Absolutely, Elena. Thank you for having us. 3 things about LivWell Health. We are focused as a software as a service solution to help bridge the gap between provider systems that are managing patients with social determinants of health-related risk areas, risk factors, and bridging that gap with home and community-based services as a background. So 3 things you need to know. Number 1 is we offer a software solution for bridging that gap towards home and community-based services more efficiently for care coordinators and social workers. Second is what we have learned in this market and extremely pleasantly surprised, is that this massive shift towards value and outcomes has really dialed up the opportunity over the last several years, as well as the large Medicaid population that is currently covered but not very well executed as part of the infrastructure of the continuum. And then third is the underlying thread that we've learned is the right use of technology in order to maximize ROI for our customers. Case in point example is a large health system which had leveraged our solution that primarily because they wanted an opportunity to customize the product as well as made it with their workflows.
Great. So you gave us a lot of information there. I want to dissect it a little bit more and make sure that we all understand exactly what it is that you do and understand some of the context in which you do it. So can you talk to us a little bit about what it means when you say the social determinants of health and how that differs from some of the clinical determinants that people might be more familiar with?
Sure. Several years back, the New England Journal of Medicine published a wide-ranging report that indicated that clinical care as delivered today in the health system impacts no more than 10% of what's known as avoidable readmissions, or in the case of the literature shows, reducing preventable mortalities. And in addition to that outcome, there's a 40% opportunity to impact avoidable mortalities by leveraging what's known as social determinants of health assessments of a patient, where they live, what they do, their attitudes towards their personal health, and activation measures all provide a footprint around whether or not an individual is more aptly to recover better as a result of a emergency room discharge than many of the other traditional means of caring for the individual. So what we do is try to, number one, assess the individual using a series of digitized assessments instead of paper-based records. And number two, correlate that with appropriate levels of interventions, whether they be community-based or within a post-acute type of setting.
Okay, that's really helpful. So I want to bring this to life even more. And you talk about how a lot of your software is used by care coordinators and social coordinators. Could you give us an example of maybe how they use your software and then how it trickles down to the actual resident or senior that's getting the benefits of this?
Certainly. The current model today is typically a care coordinator or a social worker is identified to go care for a given patient because of a certain level of discharge risk area. They'll go ahead and go through a paper-based, either Prepare is a common industry tool, or an in-home based set of assessments. And they assess and determine whether or not that individual has a risk of getting readmitted back into the hospital. And it's left to them to guide the individual by way of paper or making phone calls on their individual's behalf in order to connect them with the right resource. Unfortunately, this is a very time-consuming process. It may warrant anywhere from 48 to 72 hours, as well as actual staff time of up to 8 hours to complete the process for every single patient that is typically at risk. I know this because of my personal story from my mom when I was at Intel. And not only does it take a toll for the individual patient, but also for the families and loved ones that care for the patient. So what we did is we basically streamlined that whole workflow, anywhere from the assessments, which are digitized, all the way to standardizing the care plan for the individual and create what's known as a personalized service plan to connect the patient with the appropriate referral and service-based organizations and make it more efficient, which have resulted in an 8-hour amount of work, culling it down to less than 2 hours.
Wow. So can you talk a little bit more about your own personal experience and how it led you to found LivWell after you were helping your mother?
I was at the time a director at a Fortune 500 company leading the charge on their go-to-market efforts in the healthcare sector. She got a stroke, and unfortunately, I was a director on a VP track, having to take off the career goals and basically spend most of my time as an activated caregiver, oftentimes taking time off work in order to facilitate various medical appointments as well as attend to her needs. And so that really woke me up of what caregiving was about. I never labeled myself as a caregiver. I was just an elder son of an aging parent, and showed me how difficult it is for 44 million other caregivers that are in the nation caring for an older adult. And so the vision of the company was really born by that immediate need. And number two, if there was a way to create the moral equivalent of open table for caregiving, that was the vision that we had for the product.
Yeah, you bring up something that's really important about how you never labeled yourself a caregiver. And I think most caregivers don't. They think of themselves, as a son, a daughter, a mother. They don't think of themselves as a caregiver. So it becomes hard for a lot of the companies that are trying to serve that market to reach them, since people don't often self-identify as caregivers. And that's why a lot of companies, including yours, go for like a B2B2C model where they target caregivers and their loved ones by partnering and working with other businesses. And I think to your point about being a director on the VP track, this is something that a lot of people at that level find themselves. The average caregiver is about 49 years old. So they're probably around that same level where they're doing well in their career, looking to get to the next level. And a lot of employers are just not providing the support and the benefits that these caregivers need in order to stay in their roles and stay on their career track. And that's something that I'm really passionate about. And we're seeing more benefits geared towards caregivers, but not enough. And so I don't know if that's something that you would have valued at your time at Intel, but it certainly sounds like it would have been helpful.
Yes, absolutely, Elena. You brought up a great point. There's this notion of what's known as presenteeism and the opportunity to leverage employee type of services in order to afford as an employee benefit caregiving services is as a concierge opportunity. We saw that early on. And at the time, the opportunity did not lend itself to aligning of incentive structures. And that was really critical of how we went to market, starting with senior living as the lowest hanging market opportunity.
Yeah, that makes a lot of sense. I know that employer space is very hard to break into. You have to be able to show the ROI and get the right people, both from finance and HR, to buy into it. And it can be really challenging. And I'm just looking forward to seeing that barrier broken down a little bit over the coming years. But back to what you were talking about with senior living, can you talk a little bit more about what you see when you look at senior living and the social determinants of health now and in the future?
Absolutely. I will say I was a neophyte in the early days. I didn't really understand the difference between independent versus assisted and skilled nursing. So as a classical product guy, I started my journey by spending about a year and a half of my own nickel just to learn the market and why the answer was not yet another B2C app, which often entrepreneurs yield as a result of their personal experience. So I spent to really understand a full continuum and spoke with probably some of the leading senior living operators in the nation. I came to highly respect what they do simply because of the type of meaningful work that they care for their residents, as well as the limited amount of technology as tools to go help optimize their available time. And so when we looked at the journey, and I came from a health system and payer sector expertise, we thought that the most meaningful opportunity to engage and also develop our product were with the senior living market, simply because the need was greatest. They were in technology debt. And we started engaging with several operators that were developing their own services where they were delivering home-based services to prospective residents that were aging in place at home as a membership-based concierge program. And that was our first set of revenue into the company.
Great. So I think a lot of people look at senior living and lump it all into one bucket. And you talked about how, you were able to understand the differences between independent living, skilled nursing, and assisted living. Could you just go through what those are a little bit for those that may not be familiar?
Certainly. They really refer to different venues of care, much like different environments that individual would, as they go in higher what's known as acuity or higher set of needs, then they're going to require more services, typically clinical services, right? So an example would be in the case of independent living, they have the full richness of living independently at home, except more in a community-based setting so that they can enable the easier socialization and venues. In the case of assisted living, there's a notion of what's known as instrumental activities of daily living, such as bathing, as well as medication delivery, where they have a little more assistance with some professional assistance in day-to-day activities, in addition to the normal socialization activities. And then in skilled nursing, where you have a much larger suite of nursing services as opportunities, except it's not in a quote-unquote cold hospital room per se, in a more traditionally home-like setting within a given community. And there are several organizations across the U.S. that have offerings of independent, assisted, and skilled nursing, all under the construct of a continuing care retirement community. And oftentimes, those type of communities may have what's known as memory care units for those that are struggling with dementia and need a little bit additional attention.
Great. Thanks for going into that in detail. Do you have a specific area that you see LivWell being more successful in or targeting more than others?
We do. We've been typically targeting the independent and assisted living type of programs, primarily because, number one, in the skilled nursing and more regulated environments, there tends to have been a stronger focus in technology adoption with various EMR, electronic medical record systems in those environments. And so we didn't feel like that was a technology area that we did not want to pursue. They had enough technology investments already incorporated into the skilled nursing environment. Instead, we focused on independent and assisted living, where today it is largely a out-of-pocket experience. Many of those in the U.S. That are in Medicaid qualified type programs typically cannot afford to join or be part of an IL or AL type of community. And our goal was, can we help improve the operational efficiency of the IL and AL units, as well as enable the various at-home programs in order to further expand their reach beyond their four walls, right? So the model of the IL or AL community as a hub with a series of home-based services for residents or future residents that aren't yet ready to move in, but ultimately require just as many services as they would offer within a community.
Great. So you also mentioned that you see a technology debt in a lot of these organizations, and I can imagine the opportunities that that provides for LivWell Health, but what are some of the challenges that go along with that?
Sure. Oftentimes, this is not so much a technology, especially now. Technology is not always the answer. Oftentimes, our customers, our senior living customers, are struggling with retaining key staff in order to serve the families that they are currently are residents within their community or serving beyond the walls. Other times, it's payment models. I think that's changed dramatically with the advance of a shift towards value, although we are still living in a fee-for-service world. So we're closely navigating those type of funding and business model efforts. The landscape itself is ripe for wanting to do a series of pilots, and we're trying to help organizations transform their business in a more meaningful and sustainable way, rather than just pure transactional pilots, which may not have a commercialization impact.
Yeah, that makes a lot of sense. I appreciate that context, both of the industry and how LivWell Health fits into it. And now that we understand that a little better, can you talk to us about 3 tactics for how you've grown your business in this area? Because I know it's a really challenging market to break into.
Right. To explain further is that I knew from day one that when we created the company, the area we wanted to get into is in the post-acute care services, which encompasses the full spectrum. In some cases, there's health systems offering post-acute care type of services. Perfect example are several of our health system clients that are offering, as part of the discharge and transition program, home care, non-medical, as well as transportation and meal voucher programs to help address determinants of health related risk assessments, all the way through the actual senior living communities themselves. So if you look at the full continuum, it's not just the health systems that are at risk, but also the home health organization that they may contract to in order to deliver home-based Medicare or Medicaid qualified programs, all the way to the skilled nursing components. So we're trying to go bridge that gap. We started as a tactic. Number one was focus on low-hanging fruit, which I explained earlier as being the senior living independent assisted program to go hone our product. And we did that for the first few years of the company since we founded it back in 2012 in order to refine the product and the feature set and make it scalable. Second tactic we did was we stayed really focused on organizations that wanted to partner with us in order to do co-development, which is different than framing it as a pilot because there was a revenue component that I had always learned was important in order to get both parties to have skin in game. We obviously discounted our services, and that's the value to the organization. And the organization in kind would provide staff in order for any deployment to be successful, as well as a discounted fee structure. The third tactic we shared was we really focused on outcomes since day one. If we didn't feel like there were any meaningful outcomes we could deliver, we ended up saying thanks but no thanks and made sure that potential clients that came to us, we learned to say no. Organizations that are in their early stages of development, what I found is important to identify which opportunities make sense for engagement, because not only is it fair to the other organization, but it's also fair to our company because we were invested so much in the customers that had selected LivWell.
Yeah, so I want to highlight a couple things that Alex mentioned that are really important. So his organization did not just say, we're going to take the next 6 months and pilot our solution and then we're going to go full throttle into market. They really took a niche in the market around independent living and assistive living and co-developed with them so that they were able to create a model where they were able to charge fees, but also provide value to the organizations who were getting to have input into the features that were part of the solution. And so they were getting the services at a discounted rate, but also helping LivWell to develop the solution that was going to work best for them. And they tested this out for several years before making it scalable. So I think Alex and his team really took the time to get into the trenches and do some of that hard work. And I know that they have some great outcomes, which I want you to talk about in a minute, but they have these because they didn't just do a quick pilot, that gave them, a few bullet points that they could put in their pitch deck. They have some real outcomes that they've shown over a period of time. And this is because they took that time to really get the user's input and their partner's input and put it into the product and test it over a period of time. So kudos to you on that, Alex. I'd also like to hear about some of the outcomes that you guys have found being in these communities.
Absolutely. Thank you for summarizing that so crisply, Elena. Yeah, so I'll give you an example of one organization, and I think many of your subscribers will know them as Eschaton Senior Living. They have an amazing geriatric care management program, and their goal had always been, we anecdotally knew that we were delivering better satisfaction to the seniors that they served. However, they couldn't prove it, even though they were delivering amazing results based on the clinical providers that served those seniors. And so we embarked on a journey with Sherry Pfeiffer and team in the early days to create a falls risk reduction program. As a result of that effort, it was in the course of a targeted population of 100 patients that were funded by Dignity Health Foundation and also the Eschaton Foundation as a grant in order to assess the value of non-medical services to improve health outcomes and patient satisfaction. The results of that, although preliminary, had been nothing short of outstanding. And the Eschaton team intends to write a paper as a result of the outcomes, but it included anywhere from clinical improvements in risk. So folks that participated in the program, in the strength training classes and overall wellness program had 38% improvement in risk, greater than 30% reduction in readmission rates as associated with a fall. And the patients themselves had greater than 90% net present and promoter score, meaning they are willing to refer to other seniors as a result of the program after going through it over the course of 6 months. And last but certainly not least, the Eschaton team confirmed our suspicion that technology as a tool reduced the overall workload by less than half. And I think the proof's in the pudding when they stated that had it not been for the technology in order to streamline their workflow and process, they could not have reported the clinical outcomes. And number two, they would not have been able to deliver a cost-effective solution to empower the ROI.
Wow, I love those results. That's amazing. So obviously you figured out how to get some pretty impactful and meaningful results with your solution, but there must have been some time, whether during your journey with LivWell Health or before, where you've stagnated or stopped making progress in your career. And I'd like to hear a little bit about that and then how you got things back on track afterwards.
Absolutely. I'd say it was about 2.5 years ago where we hit a milestone where, number one, we were deploying into a large customer, which will go nameless for now, because we got pulled into the attractiveness of the brand and developing a series of solutions that were purely focused on internal to their community. And it was almost a threat to the company because they were such a large player and had so many large number of needs that it consumed almost every single resource we had in the company. And we invested heavily, believing that it would scale out dramatically, and it didn't play out that way. There were several reorganizations as a result of the organization that we had worked with. Many of the executive champions we had in place no longer stayed within the organization, and so we lost several champions for our solution to scale out the program. And it was a tough road. Both my partner Len and I were writing checks and making sure that those that stayed committed to LivWell and our vision, the employees and our vendor partners, continued to stick with us. And we got through the trough. We had a large set of orders as a result of that really helped propel the company and position it for growth. We're now in over 40 communities, and that tough time made us battle hardened. And what's more meaningful, those 40 communities, we're tracking towards a 200 community go live before the end of this year, right? So we're really, really excited about that. Not the least of which are some of the quality of those prospects, which would include Kaiser, Riverside Health System, as well as Evangelical Homes of Michigan, that's now expanding into multiple states.
Wow, that's great. So, I mean, that just shows that even in like your scariest moments when you have all this money going out and things aren't turning out the way you hoped that they would, that, you still need to keep your eye on the big picture and build your pipeline in other areas. And over time, you can turn things around. And now to have 200 communities that you're going live in this year is pretty amazing. So, given that, how do you find time to take care of yourself and just like escape from work sometimes?
It's funny. I just came back from being in Carmel for about 4 days with my pregnant wife. So in our little baby moon, just have to carve it out. I will say that there's a lot of entrepreneurs out there, particularly when you get to that midlife range where you're caring for mom as well as caring for kids. Us sandwich generation individuals, there's so many balls in the air. And so I will say that I could not have done it better without a strong team that really believed in the mission. I have a supportive family that has been with me for the last 4 years in this amazing LivWell journey. And I have a great network of professional colleagues that really help mentor me along the way. And then last, certainly not least, I will say that my perspective is always been why we established LivWell to begin with. The opportunity to impact 1 million lives by the end of next year keeps me driven that way. And I see it in the kids when I play with them at the park, to having lunch with my mom at the assisted living facility, where she is now very happy at. And then the last point I'll make is, Kresge Foundation, we made it to their annual report. As you may know of Kresge, they're an international gift-giving organization. We were mentioned as example entrepreneurial company that is changing the landscape of caregiving.
Wow. Congratulations on that. And also on your wife's pregnancy. It sounds like this is going to be a big year for you, both personally and professionally. So that is super exciting. You have given us a lot of great insights into this industry and how LivWell is helping caregivers and their loved ones, as well as the communities that they're in. But let's go ahead and close with a parting piece of guidance for all of us.
Well, I think many of your listeners, Elena, are either in the startup space or just in the caregiving role. I will say that for the entrepreneur set of listeners, you got to believe in a core mission. That is what's going to drive you through the toughest trough. It certainly drove me. For those that are in a caregiving role, I will tell you all that there is hope in a horizon. It's not just me. There's a bunch of fellow entrepreneurs that are taking enterprise level skill set and bringing talent and great ideas in order to advance more meaningful outcomes in caregiving. It's refreshing to also see the recognition in the technology community, whether they be from Intel or Samsung, that recognize the plight of a caregiver and trying to go do something about it. So more to come, and hopefully I'll be a future subscriber / patient enabled by LivWell Health in the future.
Yes.
Hopefully further away than short term.
Yes, I hope so. So believe in your core mission. It's going to drive you through the toughest times. And for caregivers, there are some valuable solutions that are coming your way. So, have hope. People do understand your plight. And I know there are a lot of entrepreneurs and established organizations that are looking to make things a little easier for you. So I hope today's episode inspires you to think more about how you can find your passion and live your best life. For more information, including links to resources that Alex and I chatted about today, and how best to get in touch with him, head on over to our website, mosaicgrowth.com, and check out our show notes from this episode and catch the Boost bonus. Alex, I want to thank you for sharing your journey with us today. And remember, anything is possible for you.
Now that you've completed this episode, the next step is to join the Boost Squad for strategic insights, tips, and tricks, as well as exclusive resources designed specifically to accelerate your personal and professional growth. All this and more is waiting for you at mosaicgrowth.com.